Firstly, we'll identify why they came in, what was the initial trigger that brought them to hospital, brought them to a feeling of despair and distress, and then try to identify solutions, what's worked for them before, how we can identify other things that will make them feel safe, therapies or clinicians or activities they can partake in that's going to make them feel more comfortable with themselves rather than at odds with the world. And I found this very successful also. I try very hard to meet the client's needs or help them to find their own solutions. And that seems to be very effective also. We generally have a high discharge rate for borderline personality disordered clients because it's been found admissions don't work unless it's a critical issue. So identifying the problem and helping them to identify their own solutions rather than telling them what they should do is very, very effective. What I always tell the nurses in ED is to lead with a cup of tea, because I find just that initial giving and showing human compassion is enormously effective in settling the client's maybe agitated behaviour or maybe demonstrative, demanding behaviour. A cup of tea and a warm blanket or a sandwich makes a huge difference and brings them a sense of empathy, and they really relate to that really strongly. It's hugely successful. It works 99% of the time. And I find even the most volatile situations, I can talk the client down with an offer of a cup of tea and a discussion about it. In terms of my fellow clinicians, and particularly in the emergency department, I think it's really important that they recognise not just that a borderline personality is a human being, but they're a human being that's suffering through no fault of their own, and they can actually have comorbid depression or other mental illnesses or circumstances that are out of their control, some of which they can attend, they can address, but some it's out of their power to capacity to control at this point in time, and that everybody goes through periods of time in their lives where they're in crisis. Persons with borderline personalities have more crisis, they have more drama, they have more demonstrative issues that they can't manage. It's really developing a compassion and an awareness that we're all on this same trip. They suffer more than we do, and being aware of that helps people to just lend a little more compassion and empathy.